which patients I normally see that want to have cosmetic surgery or want a plastic surgery, because patients sometimes don't know. They think that they're cheating, or they think that they're doing something wrong, or their families say, oh, you don't need to do that. Again, this is a personal decision for you. So hopefully this will resonate with you. Some of the first patients that I see are young patients. Young patients want to have surgery. From a young age, they have certain parts of their body that they don't like, whether it is their breast or their face or their body. They want to be thinner. They want their butts to be larger. Sometimes they think it's flat. They've always wanted to have some change. And as they get older, when they get the opportunity, they go ahead and they do. The second set of patients are adults. These particular patients either have some sort of life change. What are they? Well, some patients here, they can either lose weight, which means that they will have excess skin, or they'll have body parts that change. Their breasts will drop. Or patients who will actually gain weight. Now, these patients will gain weight for several reasons. One, as we get older, our metabolism drops. We stop exercising. We have to work. We have to take care of a family. Women have multiple children. As they do, their body changes. So these patients say, I've had a lot of children. Now my belly's bigger, or my breasts have dropped, or I did breastfeeding, and I want my breasts to be elevated. So these are patients that we see. Number three, these are patients who are older, and these are patients who are in midlife. Their children are already gone. So they now have what's called empty nest syndrome. These particular patients are focusing on me. They say, well, I've raised 4 children, 5 children. They're all adults. They're out of the house. I'm retired. I'm going to focus on me. This is something I've always wanted to do. Now, the next patients that I see, these are patients who have had prior surgery, which means that they have had different types of cosmetic procedures for any one of these reasons. Let's say patients had large implants placed in. Back in the 80s and 90s, that was part of the rage. Now patients have larger implants. They say, well, I liked them bigger back then. Now I want them smaller. Or I want my breast implants taken out. Or let's say they had a BBL previously and it's too large and they want it smaller. Or they don't particularly like that shape. So it is a matter of trying to fix this. Now, when we talk about breast surgery is not one surgery fix all. I'm starting to see more patients who are having secondary and tertiary procedures, which means that they had them lifted, they've dropped over time. What are the reasons? Well, as we get older, our tissues change, our faces change, the tissues don't remain the same. Also, if patients, as they gain weight or lose weight, the breasts will drop as well. Or patients, when they give birth, again, and they breastfeed, the breasts will change. So these are patients that are having constant changes. And again, the same thing with liposuction or a tummy tuck. The results are not permanent, so they may need another particular surgery. But again, if they want to have a change, they're not happy, what was in style is no longer in style and they want to get a change, we can go ahead and do that. But again, whatever stage of life you're in, if this is something that you want to do, it is your personal decision, and I will certainly be there to try and help you do it and give you some realistic expectations. This is Dr. Valdez, hoping to see you soon to make it curvy, sexy, and feel beautiful.